Hello, leaders! So you've written and passed your board exam, sent out resumes to multiple organizations, and patiently waiting for interview requests. Now you search YouTube, hoping that you would come across a video to help prepare yourself for a solid interview. Perfect! You've come to the right venue. Now, before we get to the cream of the crop, I would like to provide you with a brief background about myself and the intent of making this video. I'm a registered nurse by profession, served as an educator for several years, and now the Director of Care at a continuing care facility in Alberta. My 18 years of nursing experience includes med-surg, geropsychiatry, rehab, and home care. I was also fortunate to have had the ability to nurse in the United States solely to gain experience. Over the years, although my role as a nurse has changed, there is one role that hasn't: the educator in me. I love teaching and very close towards obtaining my master's degree in nursing education. The truth is, nursing can be a lot more rewarding when nurses are equipped and empowered with all the necessary skills they would require to do their jobs efficiently. Currently, nursing curriculums in Canada primarily focus on honing clinical skills, rather than giving equal importance to building leadership skills. The lack of leadership skills are very apparent in the vast majority of interviews that I have personally conducted. So if you are a brand new nurse, or a Canadian trained nurse from another province, or an internationally trained nurse, you need to do yourself a favor by first understanding the overall Albertan healthcare system, even before you apply for nursing jobs in Alberta. From my personal experience, I have interviewed some great nurses with superior clinical backgrounds who ended up being unsuccessful candidates simply because they did not know the basic regularities that govern our Albertan health system. Now let me tell you this. Most employers already know that as an entry-level nurse, you already possess the basic theoretical clinical skills. Well, otherwise you wouldn't be interviewing, would you? So what are employers looking for? Essentially, as the Director of Care and Hiring Manager myself, I would want to invest in someone who will be able to not only carry out clinical tasks competently, but also be able to act as me in my absence. I know that sounds ridiculous, but that is the reality. So here I am telling you that I would want you to be able to troubleshoot problems that arise to the best of your ability with utmost professionalism and mannerism, so that our clients, residents, or patients' needs are met. So without further ado, let's dive into preparing you for a great interview. So this video is divided into 3 segments: pre-interview preparation, intra-interview questions, and post-interview. I've arranged the subtopics in a specific sequence to help you understand and retain the information you're about to learn. This way, you can incorporate the basic knowledge required to answer the interview questions with confidence. You will see what I mean when we dive deeper into these topics. Pre-interview preparations are so crucial, and yet many attend interviews unprepared. From a hiring manager's standpoint, let me ask you, why would I consider you as a prospective employee if you have just shown me that you lack interest in knowing about my organization. I can assure you that hiring managers are able to gauge how well a candidate is prepared for an interview just within the first 15 minutes. Therefore, taking the time to prepare for an interview will definitely secure your status as a strong candidate. Pre-interview preparation includes mastering a few important legal healthcare documents used in Alberta, understanding the Continuing Care Health Service Standards, also known as the CCHSS, knowing the different levels of care in Alberta's acute and continuing care systems, knowing Alberta's emergency response codes, and doing research of the organization that you'll be interviewing for. There are 6 main legal healthcare documents in Alberta that you must familiarize yourself with to avoid legal complications. The first one being the Goals of Care designation, also commonly known as the Green Sleeve. The reason it's called a green sleeve is simply because of the obvious fact that the Goals of Care is kept in a green colored sleeve. This document is nothing other than a client's preferred resuscitation level. In Alberta, the Goals of Care has 7 different levels: R1, 2, 3, M1, 2, and C1, 2. Now, each category means something. We will not cover the definitions of each Goals of Care in this video, but if you want to know more about Alberta's resuscitation levels, check out the Advanced Care Planning video in my playlist. Now, why is this important? Because in emergent situations, you would want to know and respect a client's wishes with regard to resuscitation measures. For example, you would definitely not resuscitate a client who is deemed a C1 or 2 because the C category signifies comfort measures only. So here's a tip. When answering scenario-based clinical questions during your interview, you would always make mention of the fact that your nursing interventions would be based on what the client's Goals of Care is. This tells the interviewer that you respect the client's wishes and are committed to protecting the organization from legal implications. The personal directive, which is often known as a living will, provides specific information of the appointed agent or legal decision maker that relates to healthcare related wishes should the maker of the PD become incapacitated. So having a personal directive does not automatically mean it is active. However, once made active or enacted, that's the right term, remember this term, enacted, the appointed agent will be the main point of contact until the maker of the PD regains the ability to make decisions for him or herself. We just talked about how a personal directive doesn't automatically get enacted, even if a client happens to have one. So in the event it is deemed necessary, the document used to enact the PD will either be a Schedule 2 or Schedule 3. And this depends on how the personal directive is worded. For example, Miss Minnie Mouse has appointed Mr. Mickey Mouse as her agent and expressed her wishes in her PD that in order to deem her incapacitated, it will require her agent, who is Mr. Mickey, and one physician to enact the PD. In this scenario, the Schedule 2 would be utilized to enact Minnie's PD in the event she becomes incapacitated. Now, if Minnie would have stated that instead of her agent Mickey, she would want two physicians to be the ones to deem her incapacitated. Then a Schedule 3 form will be utilized to enact Minnie's PD. The Power of Attorney, or POA for short, is a document very similar to the Personal Directive, with the exception that it only relates to financial matters. Aha! So the key word here is finance. In other words, the POA only provides information about who is appointed to deal with the maker's financial affairs should they become incapacitated. In addition to a generic POA, there is also an enduring POA or springing POA. An enduring POA will require enactment, just like the Personal Directive needed a Schedule 2 to get enacted. A POA has its own section where it allows the physician to enact the POA. However, a springing POA comes into effect immediately upon signing. Form 1, also known as supported decision making, is a document that you would see very frequently made available to clients who are still their own decision makers but have agreed to include an appointed individual to assist them with decision making. However, the final decision must come from the client. So, the Personal Directive, POA or Power of Attorney, Form 1, Supported Decision Making, are all relevant when a client has appointed a representative. But wait, what happens if they haven't appointed anyone? That's when Form 4 comes into play. In this type of scenario, a judge representing the government of Alberta will appoint a guardian to deal with healthcare matters and a trustee to deal with finances. Keep in mind that the guardian and trustee could very well be the family members of the client. In April of 2024, which is a few months ago, the government of Alberta went through some significant changes in its healthcare model. The 4 new agencies introduced were acute, primary, continuing care, and mental health and addictions. The healthcare system has been restructured to ensure that the intended recipients receive the right services in a timely fashion. In this video, we will focus primarily on the acute and continuing care systems. The term acute simply means anything that is short-term. This includes any care provision that is lesser than 3 months. Typically, clients who are experiencing severe episodes of illnesses or trauma who require immediate medical attention receive services at facilities such as hospitals, outpatient community clinics, and community health centers. The most important thing to remember is that acute care stays are very brief and the care needs end as soon as the client leaves the facility. Now, continuing care, as the name suggests, is care provision that extends beyond acute care. Let's say a client had been admitted to the hospital for an acute illness and has to receive IV antibiotics for 3 weeks. After the first week, the client seems to have stabilized and the physician determines that it is safe for the client to continue receiving the IV antibiotic treatment at home instead of occupying a hospital bed. The physician would then arrange for this to happen through the community care center, that is, home care. Another example of continuing care is the provision of assistance with day-to-day life activities of a client, which again is arranged through home care. To help you understand this better, let's look at a scenario. Bernice is a 75-year-old widow and has lived alone for the past 10 years. Lately, Bernice realized that her arthritis has worsened in that she's no longer able to open her medication bottles or shower herself. Bernice has a chat with her daughter, who lives very far away from her, about the difficulties she's experiencing. Her daughter then contacts the community care health center that Bernice lives in for home care assistance. Home care then sends a nurse, usually an RN, to determine what type of assistance Bernice requires in order to continue living as independently as possible. The home care nurse then arranges a healthcare aide to assist Bernice daily with her medications and twice-a-week showers. So this type of arrangement is referred to as independent living with home care services. Now, 1 year down the road, Bernice's health further deteriorates after she's had a terrible fall. Bernice is now needing assistance with almost all her activities of daily living. She's unable to cook, toilet herself, and especially live alone safely. Her daughter reconnects with the home care nurse, and they all agree that Bernice would be better supported in a designated supportive living, also known as DSL-4 environment. This type of setting usually has an LPN or licensed practical nurse as the highest nursing designation. Once Bernice transfers to a DSL facility, she not only receives assistance with her activities of daily living, but with her medications and recreation therapy. Should Bernice's care needs increase at any given point, once again, with the involvement of home care, Bernice would be assessed for long-term care, which is indeed the highest level of care. So why should you know all the different levels of care? Because your role, either as an RN or LPN, will vary depending on the setting you work in. In simple terms, the Continuing Care Health Service Standards, or CCHSS for short, are a set of 20 basic standards established by the Government of Alberta. In order for a healthcare aid organization to continue operating, it must abide by these 20 standards. Otherwise, the facility risks being shut down. So when health compliance officers, or usually the auditors, visit these facilities, guess what they're looking for? You got it! They're looking to see if the facility or operator are in compliance with these 20 standards. So how are these standards relevant to you? As a regulated healthcare practitioner, your service provision must be in accordance with every standard. For example, Standard 7, Sharing of Client Information, explicitly states that clients' medical information must be shared within the healthcare team on a need-to basis only. This is because clients' health information is highly confidential and must be protected at any cost. The standard also emphasizes that all legal documents that we had discussed earlier, such as the personal directive, enduring power of attorney, guardianship, trustee, and goals of care, must be abided by when sharing sensitive information with other healthcare providers. Another example is Standard 6, Assistive Equipment, Technology, and Medical or Surgical Supplies. This standard talks about how the facility is responsible in ensuring that clients have the correct assistive devices such as wheelchairs, commodes, and walkers. Clients should also have access to medical supplies such as wound care dressings, urinary catheter, and ostomy supplies if they need them. The standard also states that any unsafe use of equipment that is being used must be reported to the government. Transfer equipment such as mechanical lifts must be used safely, usually 2 employees when being operated, and disinfected between usage. Finally, the operator or the facility is obligated to ensure that the employees they hire have received the necessary training to operate these equipment. So you see how these standards are so specific, detailed, and aimed at protecting the clients, staff, organization, and all stakeholders. Most organizations' policies and procedures are pretty much written by incorporating the CCHSS. So if you understand the CCHSS in its entirety, you will quickly understand why there is so much emphasis of staff education. I highly recommend that you pick 2 or 3 standards that you can resonate with and get to know them very well. Understand the essence to each standard that you have selected and incorporate them in your interview answers. That's the trick. But don't worry, I will show you exactly how to tie in these standards when we review sample scenario-based clinical questions. Learning some basic information about the company prior to interview is helpful in showing the interviewer of your level of preparedness. The easiest way is to look the company up on the internet to gather your data. Start by finding out what levels of care is provided at the facility. Acute care is pretty easy to identify. The challenge is more when it comes to continuing care. Make sure you identify the level of care correctly. For example, the scope of an RN in a long-term care facility is quite different than the one who works at the hospital. Long-term care RNs in Alberta are not permitted to administer IV medications. Funny, right? But that is how it is. If you are interviewing to work at a DSL-4 facility, you should automatically know that the highest designation is an LPN with the collaboration of home care RN. Knowing this will help you identify the types of regulated professionals you will be working with. Vision statements of a company is one of the most important things that is often missed. From my personal experience, I have always aced my very first interviews, often without the need for second or third interviews, simply because I took a fraction of my time to research the organization's vision and/or mission statement. Make sure you jot down these statements somewhere visible so that you can include the statement during your interview. Most often, you can do so during the introductory phase, where you're asked to introduce yourself or describe what made you apply to that organization or how did you come across that organization. These are perfect opportunities to state the company's vision or mission statements and for you to exert how this statement aligns with your personal visions and goals. When you do this, you have already impressed the interviewer right from the get-go. You have now shown the interviewer that you did your research about the organization and that you are indeed serious about working for that company. You should also need to know the client population being served. Are they infants, children, young adults, seniors? So now that you have the foundational knowledge, it is time to move on to the intra-interview phase. Almost all interviews have a basic format as shown. The interview usually begins with the interviewer asking you to provide a brief description of yourself, your educational background, and what led you to choosing nursing as a career. Here, you can start by stating your credentials, how long you've been practicing as a nurse, and other places that you work concurrently. If you are a brand new nurse, be sure to include other nursing-related jobs that you've held in the past. So, if you have served as a healthcare aide during your student years, be sure to emphasize that because it counts. The one popular question always asks you to explain why you are seeking employment with this company. Aha! Remember the company's vision or mission statement? This is when you tie it in. Please refrain from saying things like, I love caring for others, because you don't need to state the obvious that you're a nurse because you love caring for others. Limit the duration of this segment to 2 to 3 minutes tops. Be careful not to bore the interviewer by overselling yourself. Remember, the interview has just begun, and your goal is to sell yourself throughout the interview and not just at the beginning. The interview gradually moves into scenario-based clinical questions. Know this. Scenario-based questions are developed specifically to see how you skillfully incorporate basic clinical knowledge with the 4 essentials, that is the goals of care, legal directives, CCHSS, and emergency codes. Here's what I want you to do. Memorize this format: safety, nursing interventions, notifications, documentation, and communication. Use this format to answer the clinical aspect of the question. Then you will garnish it with the 4 essentials whenever and wherever you can. Again, don't worry because we will see some examples very soon. I would like to point out that these clinical-based questions are usually very vague. They give you very little data, sometimes with specific diagnosis. This is actually a good thing because you have the freedom to take it in any direction you want. Next, you will be asked questions that identify your leadership styles. Topics like conflict resolution, whether it is worker to worker, client to worker, client to client, and managing staff absences are all aimed at testing your ability to problem solve. Hiring managers are particularly concerned about you being able to mitigate issues before they get out of control. Please refrain from saying that there has been no conflicts because we know that is not true. If you're a brand new graduate, you can always use examples from your clinical practicum days. If you are an experienced nurse from another province or country, use previous experiences and highlight the positive outcomes of the conflict. Show that you're not afraid and you're confident when it comes to resolving issues. If you're interested in learning more about leadership styles, let me know in the comment box below and I can create some videos on that. Another common question is, why should we hire you? This is usually asked towards the end of the interview. Its purpose is to give you that one final opportunity to sell yourself. Of course, the interviewer should already be very impressed by now, especially after how you showed you were able to incorporate clinical knowledge with the legal aspects and standards of healthcare in Alberta. But here is another chance to rock it. Here, you can reiterate your profound understanding of the 4 essentials and how you are committed to upholding the company's missions. You could say that you are a fast learner, and that the company will need minimal time to train you so that you can start working independently as quickly as possible. A good example you can use is to show how your familiarity with the electronic health record software that the company is already using, such as maybe point-click care or Yardi. You can show that because you already know how to operate the software, you would not require too much time to learn it. This is certainly a plus point. The interview always concludes with the interviewer asking if you have any questions. Take this opportunity to ask constructive questions in such a way that would allow the interviewer to feel proud of the organization that he or she represents. Questions like, what are the company's significant achievements in the recent years? Or nurse-to-client ratio. Ask, what are the company's key performance indicators or KPIs? Now, this is a big phrase. Phrases like this takes you to a different level, as the interviewer will instantly recognize that you are speaking from a leadership standpoint. Now, whatever you do, please, and I repeat, please, do not ask what the wages are, because you will just defame yourself after all that hard work you've put in to create a great impression. By the way, when you receive the offer letter, you will find out the wages anyways. So why are you such in a hurry? You can then decide to negotiate your wages after you have confirmed your employment. However, if you are asked what your compensation expectations are, you may say that you expect to be compensated according to the current rate offered or your years of service at another province. At any given point, remember not to put others or your previous employer down. You must maintain professionalism throughout the interview. As promised, let's look at how to answer examples of scenario-based clinical questions. Remember we spoke earlier about the basic format that I had asked you to memorize? Safety, nursing interventions, notifications, documentation, and communication. And then there are the 4 essentials: goals of care, legal directives, CCHSS, and emergency codes. If you can mentally picture and remember this format, you will be able to answer any clinical questions without difficulty. Always remember to work your way from the left to right and then top to bottom. Okay, here's our first question. You are the LPN in a supportive living facility and receive a call from a healthcare aide that a resident has been found on the floor. What would you do? You see how this question gives you very little information? But the key words are supportive living facility and client found on the floor. At this point, you don't know if this was a witnessed or unwitnessed fall. The way you choose to answer this question can go in many different directions. Having said that, I recommend that you stick with the format that I have introduced you with. Remember that we are working our way from the left to right, top to bottom. So for this scenario, ensuring the safety would mean that the client is not alone and that you will instruct the healthcare aide to stay with the client until you arrive. As for the goals of care, you must show the interviewer that you would do a quick check to help you determine your next steps with regard to resuscitation. Next, you would do a complete head-to-toe assessment, which includes level of consciousness, blood sugar check, to to rule out hypoglycemia and range of motion. If a fracture is suspected, the client is not to be moved and EMS is called immediately. If this is the case, you would determine who the legal decision maker is. If there is an alternate decision maker or agent, then consent must be obtained prior to any hospital transfers. If your assessment does not support a fracture and it is safe to transfer the client, then you would follow the organization policy by utilizing a mechanical lift with at least 2 staff while operating it. By stating this, you show that you are fully aware of the Standard 6 of the CCHSS. Remember, we just reviewed it a few minutes ago. You would then initiate the post-fall clinical monitoring protocol. If you would like to learn more about what post-fall clinical monitoring is, check out my video by clicking the link in the description box. Next, you would notify all the relevant individuals of the fall. The physician, the client's agent, if applicable, the allied health team, and the home care RN, who is the case manager, would all be notified as per the organization's policy. That could include faxing or via encrypted email. When you mention the word encrypted, you are showing that you are aware of Standard 7, that you're obligated to share the client's fall incident with the relevant individuals in a secured manner. Once the client is kept comfortable, now you would go on to completing the necessary documentation. That includes documenting in the progress notes section, that's usually in the client's chart, and completing an incident report. These 2 documentations are a must. If you want to stand out from the rest of the interview candidates, you can go a step forward by saying that depending on the severity and nature of the fall, you would determine the need to file a duty to notify. I discuss what the duty of notify is all about in another video, so be sure to check it out if it interests you. Last but not least, communication within the organization is crucial so that changes in care planning can happen. Because this was a fall, you would ensure that the necessary referrals will be made to the relevant discipline. For example, for falls, the occupational therapist or physiotherapist referral is almost an automatic thing so that a reassessment can occur. Let's look at another example. You are the RN in a long-term care facility and you're approached by 2 frantic family members of a resident stating that their father was just fine until a few moments ago when he just passed out. They say that he is not responsive and is turning blue. How would you intervene? In this type of a situation, your next steps would determine 2 very different outcomes. How you intervene will completely be based on the resident's goals of care. So again, for safety, you would definitely instruct another member of your team to stay with the resident while you quickly look up the goals of care. When you have arrived on scene, you would conduct a scene survey as you have learned in BLS classes and check for breathing and pulse. Only if the resident is an R1, you would first call the code blue and immediately conduct chest compressions. If the resident is his own decision maker, and was unresponsive, then you would act based on your nursing discretion. You would then notify the physician, the agent if you haven't already done so, and all the members of the team. As for documentation, again, you would document in the progress notes, submit an incident report, and a duty to notify if applicable. Finally, you would communicate with the other regulated professionals or have a post-incident huddle or debriefing because this was just a traumatic incident. This highlights the leadership qualities in you, that you care for your team members and their emotional well-being. So you see how repetitive and easy this format is? Although every clinical situation is different, but the basics remain the same. So after you're done interviewing, it is a waiting game. Hiring managers typically contact successful applicants 3 to 5 days later. If you don't hear from them, there is nothing wrong in making a follow-up call, but ensure to leave your contact information and the best time to return your call. Leaders, thank you for taking the time to learn about the Alberta Health System. The time you have invested in watching this video will certainly contribute towards your success in securing a job as an Albertan nurse. If you find this video beneficial, share it with other nurses who are planning to practice in Alberta or nurses who are just entering the workforce. Don't forget to hit the subscribe button so that you will not miss any new content that I upload. I wish you all the best in your upcoming interview. Until we meet again, signing off as the Teaching DOC.